Okay, the next assessment that I'll be going over is shoulder flexion. So with shoulder flexion, we are assessing flexion of the shoulder complex. Some muscles that we'll be assessing are the latissimus dorsi, the teres major, the infraspinatus, the subscapularis, the pectoralis major, as well as the triceps. So we're gonna have our client laying supine, flat on their backs. We're going to have their non-testing arm just in neutral. Their testing arm, we're going to have them flex the shoulder at night, or flex the shoulder, and then we're going to have 0 degrees abduction, adduction, or any sort of rotation. So passively pulling them all the way to maximum flexion until the first sign of compensation, which would be movement in the opposite shoulder or like extra elevation. So once they start to kind of like shrug like this, just to push it up a little bit more, lateral flexion of the trunk, anything like that, then we will push it back down or push it back up just a little bit until there are no signs of compensation. Then we will record their range of motion. So with this, we're going to place the application head along the lateral side of their shoulder joint. Then we're going to take the measuring head and align it down the humerus. So right down the lateral side of the humerus. We're going to take the stationary head, so the one without any numbers, and align it right down the midline of the upper thorax. Optimal range of motion here is 120 degrees for shoulder flexion. If there are any signs, if there's limited range of motion, let's say our client gets like 105, then we would assume that the underactive muscles would be the anterior delts, the pectoralis major, the lower and middle traps, as well as the rhomboids.